Hi, my name is Derek and I'll be your nurse today. Wash my hands, close curtain for privacy. How are you doing today?
I'm okay.
Can you tell me your name and date of birth, please?
Yeah, Phillip Jackson. I was born October 10, 1982.
Perfect. And what brought you to the hospital today?
I'm experiencing some discomfort in my stomach.
And how long ago did this happen?
I think it's been going on for 3 days now.
For 3 days now, and have you gone to your primary care provider, an urgent care, or another emergency department?
No, this is my first visit.
Your first visit, and then tell me more about your symptoms. Any sharp pain, or is it dull pain, or does it come and go?
It's kind of crampy pain, and it's like in the higher part of my stomach.
Your higher part of your stomach, and then what's that pain 0 out of 10?
I'd say about a five.
About a 5, does anything make those symptoms worse? And then any stress or anything happening currently in your life?
Um, Makes it worse. Well, it started when I had some like spicy Chinese food, and yeah, it's been hurting ever since. So I think maybe like that, or like when I have kind of food that are like high in citrus, like oranges, it acts up again. Um, I mean, stress wise, I think I'm okay. I mean, just work probably.
Just work? And what do you do for work?
I manage an oil company.
Oh, okay. And that could be stressful. And then any hazards that could be posed at that job place?
No, no, it's just in the office.
Oh, in the office, okay.
Yeah.
And then what's your marital status currently? Single, divorced, engaged,
Um,
widowed?
I'm divorced.
You're divorced? And
Yeah.
how long ago was that?
That was about a year ago.
Oh, sorry to hear that. Do you have a good support system around you, good friends and family?
Yeah, I have a brother, and I mean, I have some friends, so I think I'm okay.
Oh, perfect. And then, do you have any other GI problems? Do you have any acid reflux, Barrett's esophagus, any hernias ever in the past?
No, none that I can think of.
None that you think of. Okay.
Yeah.
And then, what kind of daily activities have you been doing? Have you been like walking? Do you go to the gym? Do you work out, or anything that could have started these symptoms?
I mean, I work out. I work out about twice a week.
Twice a week. And what do you do when you work out?
I just walk on the treadmill for a bit, and I lift some weights.
Oh, okay. You just lift some weights too.
Yeah.
And then, do you take any medications, or did you do any other treatments to help with those symptoms, or does anything alleviate it?
No, none that I can think of.
Oh, okay.
I just rest.
And then, do you have any medical conditions we need to be aware about? Any heart history, any lung history?
I have ADHD, and I take Adderall for it.
And then, how often do you take Adderall? Do you take it once a day?
Yeah, yeah, once a day.
Take it once a day. And then, do you have any allergies we should be aware about? Any allergies to any medications or any environmental allergies like nuts, pollen, grass?
Um, yeah, I'm allergic to nuts, like a good amount of nuts.
Okay. And what happens when you eat nuts?
I just get itchy and I break into hives.
Oh, okay. And then, any recent hospitalizations recently, or any surgical procedures recently?
No, no.
No. Okay. And then, any over-the-counter medications you take, or any herbal remedies, or it's just the Adderall for your ADHD?
Yeah, just the Adderall.
Okay. And do you drink any alcohol? And if so, how often?
I do. I'd probably say twice a week. I take it on the weekends.
Okay.
It's with friends.
And then, what do you drink?
Just a couple of beers, maybe two or three beers, and then like a glass of scotch, maybe.
Okay. And then, do you do any recreational drugs or smoke at all?
I used to about 3 years ago.
3 years ago. And how long did you smoke for?
10 years.
10 years. Okay. But so you told me you have history of ADHD. Does your family have any history of cancer, colon cancer, any GI symptoms, any cardiac history or lung history that you were about, or kidney,
No,
liver problems?
I'm. I think the only like issues like my dad's side is my dad and my grandfather is diabetic, but apart from that, just them.
Okay, nothing on your mom's side.
No, none.
Nothing on your mom's side. And then have you gotten recent blood work with your PCP to
Yeah,
see your hemoglobin A1C or any other lab work?
I did. Yeah. I was diagnosed pre-diabetic.
Diagnosed pre-diabetic. Gotcha. And then tell me about your sleep schedule.
I usually get about 5 hours of sleep every day.
5 hours of sleep.
Mm-hmm.
Gotcha. And then do you feel well rested usually?
I'm okay. I mean, it is what it is.
Okay. And then what kind of diet do you follow? Do you have a diabetic diet? Do you just have a regular diet? Do you have a high fiber diet?
Just a regular diet.
It's a regular diet. Gotcha. And then tell me about your bowel movements. Do you have one once a day, once every other day, twice a day,
Maybe once every other day.
once every other day?
Correct.
Gotcha. And then do you urinate often or too much?
Um, I think I just urinate usually like once a day or twice a day sometimes.
Okay.
Yeah.
And then any physical changes you've noticed besides that pain in your stomach? Any symptoms anywhere else?
Mm, no, none that I can think of. Yeah.
Okay. And then is English your main language or do you speak any other languages?
Just English. Yeah.
Okay. And then any cultural considerations we have to consider while you're here?
No.
No. And then regarding food, you're not pescatarian, vegetarian, anything like that?
Yeah.
I
No, I
know
don't have any dietary restrictions.
no dietary restrictions. Okay. And then do you want us to call a chaplain or anyone to assist with you, or do you have a good friends and family that can come hang with you?
Yeah. My brother can come pick me up if needed.
Perfect. And then any religious beliefs or anything we have to consider while you're here?
No.
No. Okay. Alrighty. So I'm gonna be getting your vitals right now. All vitals are within normal limits, and then I'm gonna go speak to the provider. So he's gonna come in here, gonna talk to you about the plan of care. Likely gonna get some lab work on you. Gonna get some imaging on you.
Okay.
See what's going on with your stomach, and then we'll go from there. If you need anything, here's a call light. Then we'll leave the room. Wash hands.
Thank you.
Leave. Thank you, sir.